In this video, I'm going to talk about 6 different filters that are a little bit unusual to use for Syntonics because we use them for things like modifying behavior and mood. Let me explain that a little bit more. But before I do, I want to tell you how you can connect with us. Call us at 618-288-1489 if you're local. If you're not local, we can still work with you. Please go to our website at visionforlifeworks.com. And the best thing to do is schedule a consultation to talk with us about how we might be able to help you. Now let's talk about these 6 unusual filters that aren't always used in Syntonics, especially those programs where it's just about red and green, which is probably about 96% of the programs that are out there. But let's show you blue and yellow, purple, red. Can't really tell on these, but these are more on like blue and blue-green spectrum. So let's go through these. What do these filters actually do, and why would we use them? Why do I need to modify behavior or maybe personality or some things that could be going on with our patients? Well, first, let's be really clear. I'm not here to be treating some sort of mood disorder, behavior disorder, or anything like that. The only reason why we would use these filters is as it pertains to helping someone with their vision. So I'm going to walk you through a couple of the uses of filters that, again, I use them a little bit differently than most patients or most other offices do for their patients. So something like this, for instance, a blue and a yellow filter. Sometimes our patients have problems with severe anxiety. Even some of our younger patients, they may have something like a test anxiety. Maybe it's an anxiety over flying or something else that they need to do. I had a patient just 2 weeks ago, and she was really feeling a lot of stress and worry about a presentation that she needed to give. So these filters, what we'll do with them is we'll try out which one is the best one for the individual. They'll wear them right before that thing that's causing them to feel that panic. And it just helps to take the edge off and helps them to be calm. It calms those frayed nerves and they can perform better. I also had a patient years ago that she was trying to take a test, and it was for, becoming a beautician. She had failed it a lot of times, and she was really concerned because this was her last attempt. And so what we did was we said, try this filter out once we determined which one would be good for her. Try it out before you take the test, but do like a mock test first. Well, they were so kind. They actually set up a mock test for her to do. She tried it. She did really well, but it wasn't the real test, so they couldn't keep her score. But she used the filters right before her other test. She passed, and she did great. Now, that's one example. The second example I said just not too long ago was the lady who needed it right before her having to give some sort of a talk or a presentation. And so she used them to help calm her nerves. She even said what was amazing about them is that the effects lasted for a couple of days, and she wanted to know, can she have them all the time? Okay, no, we're not really trying to alter these sorts of things, but again, if it's pertaining to something that you're doing in life, and it's visual in nature, and we're correcting and fixing that, then absolutely it completely makes sense to try to adjust something else that could be going on. Let's talk about another one. This purple filter is actually good for people who have a lot of anxiety and OCD types of tendencies. So for instance, if they are so worried about managing their desk and straightening their papers and having their pen or pencil ready that they can't even get to working on the visual activities we want them to work on, that's a problem. They can't even get out the gate to getting better. So we have to do something to try and calm and alleviate those types of anxieties. So this filter can help them calm down, stop trying to think about everything of needing to be hyper organized with it, and then they can proceed with getting better by the activities that they're doing for their vision. Now, there's another filter. It's more on the red spectrum of things, but that one is balancing out the sympathetic to the parasympathetic system. Now, we have a nervous system that runs, our autonomic nervous system that runs our body. And the sympathetic does things like keeps your heart beating and you get excited, and so you have lots of energy. And the parasympathetic can be more thinking about that one, like after you've eaten a big meal and you might feel a little tired. Think about Thanksgiving. The turkey sleep off is what I call it. And you feel a little sluggish. All right, well, your body's processing food, and so, some of your mental power is not really as keen and with it, and you might feel like you're a little bit sleepy. And so this filter balances that sympathetic, where you feel like you're intense and just maybe on the edge of your seat, like ready to just take fight, okay, or take flight. And actually, we think of this like a fight or flight situation. So if someone is thrown into that fight or flight all the time, it's not a good place to be in. They have trouble with sleeping. They have trouble with calming down. They might have lots of anxiety. They even may have problems with adrenal glands, which if that gets thrown off, then that's definitely affecting your sleep. And down the road causes a lot of health issues too. So if I've got someone who's just too far, like sympathetically driven, or maybe too parasympathetically driven. The sympathetic person looks like they're on edge all the time, nervous. They may even twitch and hold themselves really tight. And the parasympathetic person is going to be more like yawn. I just can't muster up any energy. They're like really, really too relaxed. So there's a filter that helps balance that. And it's really important because the sympathetic and the parasympathetic system also do things like balancing out the size of your pupils to help you respond to light indoors and outdoors and at night. So if that system is thrown off, it can affect your pupil size, make you light sensitive, and even cause you to have difficulty with focusing, because pupil size does affect our focusing ability. So that's an important one for us to get balanced in order to help you with your vision. Now, I have two others. Again, these are all somewhat a little bit different, not typically used by most doctors' offices whenever we're treating patients and using Syntonics. The two other filters are really more, there's one that's a little bit more about hormonal upset. Now, and balancing that. Why on earth would we need to be concerned about that? You're not really concerned about someone's PMS, right? That's not what I do. But if it is getting in the way of them being able to focus and they're having problems with being angry or frustrated or just on the opposite end, really depressed, and they can't manage that, there is a filter that helps to balance out some of those hormones. Now, that's important, again, because they need to be able to have, a lot of different types of balance are needed in order to work on your visual system and to get a healthy change with your visual system. And if you're just constantly I'm just feeling so angry and so mad and I just can't even concentrate, we need to balance that out. So that would be problematic to try and get them to have their best outcome visually. The other filter is also about balancing emotional upset. And I will have patients who have had difficult traumas. So maybe they've had some sort of a traumatic brain injury. Maybe they've just gone through a traumatic experience in their life, or maybe they're even traumatized by the fact that they've fallen and hit their head so many times, and they're really concerned, they're going to do that again. Or on the flip side of that, I have patients who are so neurologically just compromised that their bodies just can't even calm down. They're just up and down all the time, and they just can't hardly focus or be still or find comfort in just being still. And so there's a filter that helps us to get some level of balance emotionally. And so we may have the patient use any one of these filters for just a brief clip of time. Maybe it's once a day. Maybe it's only once a month. Maybe it's once, twice or three times a day, depending upon what we're trying to deal with. But there's usually a period of time that we may have to deal with any one of these things before we can really get down to the root of correcting the visual problems that's going on with them. Now, of course, if they have long-standing or serious issues, our main job is to get them into the hands of professionals that deal with this every day. That's not our job. I don't deal with this sort of thing every day. However, again, in the course of treatment of visual things that we're working on for our patients, it may be really necessary to try and get them to be balanced, more emotionally stable, not focused and hyper-focused on OCD tendencies, or having such a high level of anxiety that they just can't even, function. So if you found this video to be interesting, definitely make sure to like it, subscribe to our channel if you haven't done so already, and please pass this video on also if you feel like it would be beneficial. Thank you.